Hi, my name is Samantha and I'm a physiotherapist with special interest in women's health. And in today's video, I thought we could talk about sleep during menopause. This is a topic that a few ladies express interest in, and so I've done some extra research. And over 60% of ladies in menopause struggle with insomnia, and there are changes in the hormones that explain this. So we know we got decreased estrogen and decreased progesterone, but what also decreases is our melatonin, which is our sleep hormone. And we have an increase in cortisol, which is our stress hormone. So this means our sleep drive and our ability to fall asleep will be impaired because of the decrease in the sleep hormone melatonin. And also the increase in the stress hormone means that we might be feeling anxious when we're supposed to be falling asleep. We should be in our parasympathetic nervous system or our rest digest nervous system to sleep. If we look at progesterone as well, this hormone also calms us. It decreases our anxiety, which is why sometimes people feel more anxious later on in life in menopause than they did before, also because of the decrease in progesterone. So we also don't have the help that progesterone gave us to fall asleep. The decrease in estrogen also impacts our sleep. We can have more broken sleep because estrogen helps us to stay asleep. It also helps us go into REM sleep, which is our rapid eye movement or our dream sleep. And it has a role in the secretion of AGH, which is our human growth hormone, which gets secreted during deep sleep. And HGH is our high performance enhancing hormone. It helps us to burn fat, it stimulates tissue growth, to build muscle, and to recover faster. So what we can do because of the decreased production is capitalize on the fact that our brain will always secrete more AGH during the time 11 p.m. to 1 a.m. So being asleep early enough to get your AGH. When we're not sleeping, we have a decreased sensitivity to insulin. A study showed that just one night of poor sleep can decrease your sensitivity to insulin by 33%. So this really impairs your body's ability to restock your glycogen supply, which you need to feel fresh and recovered, and obviously will also mean that you've got a higher chance of weight gain. When we're also looking at someone who's sleep deprived, often they've got an increased appetite because the appetite stimulating hormone ghrelin has an increased production when you're sleep deprived. Your cortisol levels also increase, so you've got more stress hormone than you would have just by being in menopause. And cortisol is a pro-inflammatory hormone. So we want to get everything as balanced as we can because these imbalances can shift us into systemic inflammation, and that increases our risks to cardiac disease and things like that, which we don't want. So if we look at some of the specific things, general sleep hygiene is important. And with the melatonin decreasing, you can go to your doctor and get a melatonin supplement, but I would also think it's more important to try and decrease the amount of bright lights closer to bedtime, no screen time. You can practice things that bring you more into your parasympathetic nervous system, like calming hot baths, yoga, massage, deep breathing, diaphragmatic breathing. You can meditate, you can pray. These are practices that a person can do to bring yourself more into that parasympathetic. It's also to increase your sleep drive. It's been found to be helpful to exercise in the evening, not later than an hour before you go to bed. So you want to have finished and still have an hour and then go to bed. So but it has helped some people, and it was thought to be not good for you, but they did a big meta-analysis in 2019 and it has no negative impact. It's just not, you still want that hour before you go to bed. And the type of exercise might also make a difference. So something like yoga is going to be more helpful for sleep than sprinting, but exercise in general can help with that sleep drive. And then for the interrupted sleep, making sure that you've got a cool room, making sure that there's blackout curtains, that anything that might wake you up doesn't, that you've kind of created that space with no interruptions, maybe keeping your pets out, no kind of white noise that could wake you up. Those types of changes could also make a difference. But I hope that this helps you to understand at least why you might be struggling more now than before, and to give you a bit of insight into some of the changes that you could make.